Greetings everyone, I'm Jeff Bourgeois here again at San Juan Regional Medical Center to provide you with an update on the statewide and local activity around COVID-19. I'd first like to remind you to always go to our public website at sanjuanregional.com. On that homepage you will see a link to our coronavirus resources that can provide you with important updates and statistics about our response to COVID-19. As we shift and look at what's going on at the state level, the good news is the R effective rate, or rate of transmission statewide, has continued to decrease and is now down to 1.0. If we break that down on a statewide basis, you'll see the state has divided the state into 5 regions. Our county, San Juan County, of course, is in the northwest region along with McKinley and Cibola counties. The R effective rate for our region is now down to 0.8. That's the lowest region in the state, and we've now seen consecutive weeks of week-over-week decline in the rate of transmission within our region. Also, when you look at the data the state puts out and look at the relative growth rate of 14-day range, you'll see that now the northwest region is the lowest in the state again. And 4 of the 5 regions show a decline in the 14-day relative growth rate. The 5th region has only a slight increase and is just barely above that line, that horizontal dark blue line you see that would indicate decreasing case count. So some positive trends developing in the state, but we are certainly not out of the woods. This next slide shows you our statewide COVID-19 hospitalization trend. Now, back in mid-May, we experienced a peak statewide where for a period of number of days we had well over 200 COVID-19 hospitalizations statewide. We saw that fall off, and in the 3rd week of June we reached the low. But since then we've seen a turnaround in the number of hospitalizations statewide. This data is from July 17th, and as of today, Department of Health website is reporting 167 hospitalizations statewide. So still a lot of activity statewide regarding COVID-19, particularly in the hospital setting. So let's not let our guard down. This virus is still widespread throughout not only our state but also in the country. Now, as we look at what's going on closer to home here at San Juan Regional Medical Center, I want to give pause here and share with you a little bit of a story I heard of today that focuses on the struggles not only patients are having, but our frontline caregivers and the challenges they meet day in and day out. This story is about a gentleman who has been on a ventilator for 12 days with a total hospitalization stay of 33 days now. It had been literally weeks since he has been able to stand on his own. So with the help of one of our wonderful ICU nurses, respiratory therapists, and physical therapists, they were able to first get the gentleman to sit on the edge of his bed, and then secondly, with the help of the physical therapists physically behind the man, supporting the gentleman and his legs from collapsing underneath him, helped the patient stand up for the first time in literally weeks. The patient became emotional, but what was important also was in this story is the determination of the patient to stand on his own. And after a couple of periods of rest, he was able to do that. Again, the patient got emotional, as did the caregiver team. Just a glimpse of it inside an ICU room of a COVID patient, and what the patients are experiencing as well as our caregivers. So let's not forget the tremendous perseverance, compassion, and clinical excellence that our caregivers are bringing to this COVID-19 response on a day in and day out basis. There are literally dozens, if not hundreds, of stories similar to this that we could share that really focus on the commitment that the frontline caregivers have to helping not only COVID-19 patients get better, but everyone else who is experiencing an inpatient stay. So today at 7 o'clock on July 24th, our census was 117. 25 of those were confirmed COVID positive patients. We had another 7 who were pending a test result, or as we call them, maybe a patient under investigation. So we have those patients on our fourth floor, which is dedicated to COVID care at the time. A total of 8 intubated patients in the hospital. 5 of those are in the 4th floor ICU and COVID positive patients. So that brings to date a total of 482 inpatient COVID patients that we've admitted since the beginning of this pandemic. We are rapidly approaching our 400th discharge. What a great testimony to the tremendous efforts of our caregiver team and all of the support team throughout San Juan Regional Medical Center. Tremendous work. We do acknowledge 70 deaths at our facility from COVID-19, and it's important to realize that this is a severe illness, and it is indiscriminatory about who it attacks, and we all need to be careful and keep our guard up. As I mentioned earlier, we still have 25 COVID positive patients in-house. This slide shows our day-to-day census trend, and the dark blue line on the top is our total census, and at the bottom again you'll see 3 lines dedicated to COVID-19 patient population. The red line is represents the patient under investigation. The green line above that is the line that represents the true COVID-19 confirmed positive census on a day-to-day basis. And the purple line slightly above that green line is the total COVID-19 census on our 4th floor that is both positive and patients under investigation. So that purple line has really been relatively flat over the past week, hovering right around 30, give or take, in terms of the total COVID-19 census on our 4th floor. Our overall census has rebounded from a low back in early July and is now ranging anywhere from 115 to 135 on a day-to-day basis. So let's talk about some key points to take away. Statewide, the transmission rate continues to decrease. In our region, the Northwest region, has the lowest rate of transmission of any region within the state. However, this is still a disease and virus is very prevalent in our state, and as of today, there are still 167 patients hospitalized in New Mexico with COVID-19. To reinforce that this is still a deadly virus, and whether or not you are sick enough to to have to be hospitalized or just recover at home, this can impact your quality of life significantly. So on behalf of our entire organization, I want to remind you to do the simple things and exhibit COVID safe practices. Wear a mask, wash your hands often, and when in public places, in addition to wearing masks, practice social distancing. Also, just know that San Juan Regional Medical Center is here to serve your healthcare needs. We have reopened our clinics to in-person visits, but we are encouraging virtual visits wherever possible to support patient convenience as well as safety. We have opened our surgical, procedural, and outpatient diagnostic schedules and venues in accordance with the Department of Health rules and COVID safe practices. Please contact your physician's office to schedule any type of appointment or procedure as needed. Please know that our hospital, our emergency department, our urgent care center, our clinics are open to safely deliver the care you need and deserve. We strongly encourage you not to delay care if you need it. We are here to help. A dynamic that's played out not only here locally, throughout New Mexico, but across our country is a fear of patients who are sick from non-COVID related reasons in seeking health care. That has led to patients finally presenting to the hospital or their physician's office in a state of health greatly deteriorated, and they've almost waited too long in many cases to come to the hospital or contact their physician. So if you feel you are sick for any reason, do not hesitate to seek care. Take care of yourselves and your family. And thank you for trusting us here at San Juan Regional Medical Center with your healthcare needs. We do have a few pointers relative to what you should do if you come to one of our facilities for treatment. We ask that you arrive a few minutes early. so we can complete the COVID-19 screening process to ensure your safety as well as the safety of our caregivers. We have taken great strides to create an environment that is safe not only for our staff but for employees and visitors and medical staff. Therefore, we're asking that when you come to the hospital or one of our health partner clinics, wear a mask. Our goal before, during, and after this COVID-19 pandemic is always safety. And finally, just a reminder of our continued visitor restriction policy as we deal with the COVID-19 pandemic. So right now, no visitors on the COVID floors. On the non-COVID floor, only one visitor per patient in order to keep everyone safe. There will be a screening process when you present to the hospital as a visitor to see a patient. And we also want to encourage you to connect via FaceTime, Zoom, regular phone call. We have an e-greeting set up on our website that you can connect with patients. Encourage those. We've had a really nice response to that. Friends and family members are taking advantage of that. So you can find that on our SanJuanRegional.com website as well. So in closing, thank you again for your support. We truly hope you find these weekly updates beneficial to share with you what's going on both at the state and local level relative to COVID-19. We appreciate your support of San Juan Regional Medical Center. And again, let's remember those folks, not only those who are hospitalized and ill during this time, but those frontline caregivers throughout our community who are dealing with very challenging patient care situations, but never backing away from the challenge. We should hold them all in high regard, and they all deserve our respect and appreciation. So thank you, and until next week, have a great day.